introduce myself. I'm Barbara Derrick, and I'm the interim executive director for Smoke Free SC. Just wanted to let everybody know that Rebecca Jacobson recently resigned her position. She sure went out on a high note, having coordinated a wonderful and informative summit this year. I hope you all were able to attend it. If you missed it, or if you want to see any of the presentations again, they're on our YouTube site, and there's a link to it on our website, or else you can go to YouTube and just key in Smoke Free SC and all of them will pop up. I also want to introduce two of our newest Smoke Free SC board members who are on the call, Tammy Timms and Joey Current. So we're glad to have them join us. And since I know everybody is here to hear Dr. Keely and not me, I'm going to turn this back to Tara to start the meeting. Thank you.
Thank you, Barbara. Again, thanks to everyone for joining us. We are excited that Dr. Keely and his team from York County are here to present for us this morning. I am going to stop sharing my screen, and I'm going to hand it over to Dr. Keely, who will introduce himself and then begin with his presentation.
Good morning from Rock Hill. I put a little information about myself in the chat, so I won't take time to do that. I am going to try to tell a little bit of the story of the Tobacco-Free York County Coalition, and let me share my screen. And particularly ending up with the focus on the tobacco retail licensing efforts that we've been involved with grant support through Smoke Free SC. As far as slides, let's see. Arrows aren't working. Let's see. Tara, what should I do for changing slides?
So the arrows aren't working? If you click the screen.
Oh, maybe that's what I need to do. Okay. There we go. Thank you.
You're welcome.
Okay, so as you can see, we were really got organized in 2007, but before that, we were a combined drug and tobacco prevention group in York County. In a lot of support from DHEC through the years. One of our first slogans was "Make it happen," and that we used that when we got the ordinance passed for 100% indoor smoke-free workplaces in Rock Hill and York County, and also Fort Mill and Antigua. And you can see our logo that we developed at that time with the fresh air kind of coloration. And here I am, you can see with our, this is pre-COVID, of course, and you know, we would table at different events around the county. Here's one outdoors at Winthrop University, a great partner that we've had. And here's our newest logo, our new 2020 logo we developed that highlights the TFYCC. And
Riata Scott, join the meeting.
Okay. So over the years, our key initiatives, this is kind of a busy slide, but you can see the reference to secondhand tobacco smoke exposure protection. We've always been a strong proponent of the tobacco quit line, and we had I've been involved with a March of Dimes grant, working with women of childbearing age and tobacco product use. And then you see our point of sale surveillance. We also have done tobacco policy and faith-based organizations grant from the National Elks Foundation. We've done education on electronic nicotine delivery systems, particularly with bringing speakers in. Winthrop University make space available and continuing to work with Winthrop University to achieve a tobacco-free campus. Hopefully now, with the new president, we'll get that moving again. And then we have a really strong partnership with our local county alcohol and drug abuse and other drugs agency, Keystone. And so we've focused some on marijuana there as well. I do want to kind of highlight one of our most proud evidence is of the impact of removing indoor tobacco smoke from all workplaces. Just real quickly, this shows the 3 years prior to the ordinance taking effect in our area. And you can see that it's a little hard to see from at the top of the screen, but down here you can see that the rate prior was we're at the 25 range, and that's the 3-year average rate from 29 to 2011, then decreased to 20 per 10,000. This is acute myocardial infarction hospitalizations in age 35 plus years York County residents. So we had a 20% decrease in the 3 years following. Now, some of this was certainly also helped by the fact the cigarette tax went up in 2010. But we have good reason to believe that this type of decrease had a lot to do with our indoor tobacco workplace free policy ordinances. So there you can see that. Down to 19.1. And the population in York County, 122,810. So that's, it comes out to, we take the 10,000 rate, a 20% decrease. It's over, we prevented over 60 acute myocardial infarction hospitalizations. Yeah. So partners, I've mentioned this at the summit. We enjoy, and I know some other counties in South Carolina enjoy great partnerships. And as you can see, I mentioned Keystone, and over the years, Medical Society, then York County All on Board, which is a local initiative to reduce and prevent underage drinking and alcohol and tobacco and other drugs. And I mentioned our agencies of higher learning, York Tech, Winthrop University, Clinton College. And then our public school districts, we've had a presence on their wellness district, community coordinated school health advisory committees. And now Holspire, York County has broadened its base of, and we do know that kids that don't smoke in teenage years exercise more. So that was a key partner realization that we had. And then as I'm going to mention, our municipalities in York County, we've had really good opportunities to work with. And then regionally, of course, with Charlotte to the north, tobacco-free Mecklenburg, we enjoy not having preemption in South Carolina. It's interesting to talk with tobacco-free Mecklenburg. There's stories about the problems that they face with preemption regarding tobacco. And then our neighboring counties, we've shared ideas and helped each other out. And then, of course, the DHEC Midlands region team, we work with them. And as far as the state level, you probably recognize these acronyms: Smoke-Free SC, Heart, Lung, March of Dimes, Cancer, Tobacco-Free Kids, and the Americans for Non-Smokers' Rights Foundation. Our newest partners, you might be interested, with efforts to go smoke-free and multi-unit housing. We actually, I should add Fort Mill in here too. We've had really, good communication, and of course it didn't hurt that HUD went ahead and went for smoke-free indoors in the HUD housing. And then the firefighters, you don't think about it, but firefighters are really enthusiastic about, the whole issue of tobacco smoking in bed and fires, house fires. And then we have a new Faith and Health Coalition that ties us with about 150 churches in York County. So we educate through there. With the latest news yesterday about Juul, I thought you might be interested. This is a 2018 map of all the places where Juul was available in York County. And, here's Rock Hill in here, and Fort Mill over here. And, but you can see that there's plenty of access to Juul, in 2018, and that's actually gone up with the number of vape shops that have opened. So when it comes to tobacco retail licensing, there's great resources available that we've been able to tap into through Counter Tools and Change Lab Solutions and the Tobacco Legal Consortium. And this is just one of the 4 pages of a short document that explains TRL. The timeline for our initiative really started with the Counter Tools point of sale survey that was introduced, and we were able to get on the first round here in York County in 2017. And then we followed that up with some of the findings, which I'll show you some later in the presentation, that we really needed to get some constituent attitudes and information so that we could be convincing when we talk to elected officials. So we partnered with Winthrop University's Social and Behavioral Research Lab, and really got some very helpful information, which I'll give you a snapshot view of a little later. But overall, we felt we had a favorable environment to seriously pursue TRL in a couple of our municipalities and at the county government level. So we applied for the impact grant in 2021 to move forward with that effort. And then with COVID slowing everything down, fortunately we were able to qualify for the grant extension, get involved in the 5 years later Counter Tools point of sale survey. One of the partnerships benefits is that in the first survey in 2017, we did gather information about alcohol sales in the tobacco retailer sites, and we wanted to be able to do some 5-year follow-up on that information and get some updated information, based on all the new options that are out there for folks. And so we developed this one-page paper survey, and it'll give us an ability to give our alcohol partners an updated view of what's going on at the retail point of sale level. And we developed this picture sheet to go with it so that they kind of knew what they were looking for. So for the roundtable discussion today, and I wanted to really hit in the next 15 minutes or so, quickly hit these 10 points. So let me quickly show you. This was the 2019 survey that we did. We had, this is cell phones and landlines, and we did a sample, a calculated sample for significance of almost 800 households, adults over 18, and interestingly, we got good idea of raising the legal age, prohibiting near schools, but interestingly, they didn't want to prohibit in the grocery store, so we have to look into that a little bit further. Pharmacies, we've since this time have, I think CVS has gone ahead and eliminated tobacco sales, and we're trying to do a little bit to communicate with Walgreens to get them to stop selling tobacco products. And then this was really good to see. We had a lot of people that recognized outdoors with the beach areas around Lake Wiley and a lot of parks in the Rock Hill area where children are playing. We have been able to get the city of Rock Hill to put up signs to discourage people from smoking in the playground areas. And I thought this was an interesting, there's plenty more that came from the survey, but I thought this was an interesting one to show you that over 50%, almost 60% of people do view smoking as an addiction. And so, that helps us when we're making messaging. We talk about nicotine addiction a good bit. And we did get some information on e-cigarettes. You can see on the left, this is people who ever tried e-cigarettes. And of those who currently smoke, look at that, almost 70% tried. And of those who do not currently smoke, over a third had tried e-cigarettes. Again, this is 18 and above. And then we have not felt the political environment was good to reopen the indoor smoke-free, tobacco smoke-free ordinances. But with this from the survey, we think we may have a better opportunity now to show our elected officials that vaping, should be included in our ordinances. So with all of this information, we had also met with city planning and zoning officials in Rock Hill. There is an option to through zoning to prohibit tobacco retailers from locating in certain locations. Rock Hill, the second bullet, Rock Hill has very irregular borders. So when we did the indoor tobacco-free environment ordinance, it was important to have the city and the county have the same ordinance, which we accomplished, so that someone couldn't claim that, well, down the street, you know, they're not under the ordinance, just, you know, a block away across the city limit. State level legislation on TRL. There have been bills introduced. We did kind of hold off on some of our local TRL efforts this spring, since there was some interest in a state level bill, but it died. So we're now moving full steam ahead with our local efforts. Of course, preemption also died, so that allowed us to move forward. And we want to move forward quickly before something else happens next legislative session. We haven't gotten to this point yet, but the Smoke-Free SC staff offered to help us with our mock budget, because when we present the proposal for TRL, they're going to wonder, well, how much it costs and how do you finance this? So that's where the budgeting help will be. So with all of that in place, we made the decision, you know, to continue to move forward here in York County. So going through the 10 things I listed, we've, you know, developed an issue brief, the case for tobacco retail license in York County, which is a 3.5-page document that lays out particularly the savings in terms of health and you know, and youth health, and also presents the issue that we are in a fast-growing county, and we need to have a way to really, quote, control where tobacco retailers are locating, because we know the tobacco industry is very much about advertising in lower income neighborhood areas and near schools. Second point, with elected officials, I mentioned this at the Smoke-Free SC Summit, Champions has really been our key to getting things through with elected officials, and with the champion we're focused now on Rock Hill City Council, and then also the York County Council, and then we do 2-on-1 meetings and these are just educational meetings. There's no real ask. It's just to educate with the help of the white paper. Well, actually, we call it our issue brief. Sorry, with our issue brief, and we're in the process of finishing our second round of store assessments. And once we have the 5-year comparison data, then we'll really hit the ground running with these meetings with the elected officials. Foundation laying, part of what we've done, York County Council has a Health and Environmental Protection Committee. And so part of our strategy has been to get a relationship, open communication back and forth relationship just on health issues with this committee. And so I made a presentation a couple months ago just talking about primary health care and public health in 2022. And so that's a foundation to work on. And then the foundation with Rock Hill City, really, we have 3 current council members who were very instrumental in the back in 10 years ago with the 100% smoke-free indoor air ordinance. So we'll be continuing. We have continued to communicate with those three, and we're feeling that foundation will benefit us at this point. Key collaborations mentioned Keystone, York County, our alcohol and other drugs agency, and then York County All on Board. You know, they very interested and you know, helped us develop the paper survey. We'll be sharing the results with them as soon as we get the assessments and the surveys processed. Of course, the pandemic made it so that we couldn't move ahead with community education. And then we had the 2020 election, so we had some changes on our municipal and county councils. But what we have found is social media has been a really great way to build our following and steering people to the Tobacco Free York County website, where we have, you know, additional information. But Facebook, Instagram, and Twitter are the ones we're involved with. We think we're reaching the age groups that we need to with those. The social media following is going to be our key to mobilizing constituent voices. We haven't unleashed this yet, but once we have our meetings with the elected officials, with the latest survey data, we will be putting out more through our social media on what constituents can do to alert their elected representatives to support this effort. And I mentioned we're looking forward to being able to provide some longitudinal information, the least of which is that the continued growth of York County has brought in a broader number of tobacco retailers, and the location of these retailers continues to be in areas that advertise in lower income neighborhoods and near schools. I forgot to fill this in. Having the grant support allowed us to develop a part-time community education and data coordinator. And Erin Paradiso has been a great person in that role. She's a master's level trained social worker from Winthrop, and we caught her at the right time when she was looking for work after she graduated. And she's on the call, and when we get to questions and answers, if you have anything you want to ask Erin, should be happy to. Community education, this is something that I need to mention. At the Smoke Free SC Summit, the folks from Charleston mentioned the idea of having the arts to draw a large audience. And so we're going to steal that idea. And when we have our community education event in September, we're already looking to line up music and art exhibition and to draw people, and then kind of be like a commercial interlude. We'll talk about TRL. And then finally, we have not budgeted, but we may end up having to put some money towards, we want to have a lawyer who's not involved with the municipalities or the county to review the there's a model South Carolina TRL ordinance that was developed by the National Tobacco Legal Consortium. And so we wanted to just have it reviewed for any wording that might be a snag in South Carolina before we submitted it for review by elected officials and city and county lawyers. So quickly, now that I've finished the 10 points I wanted to cover, I've got a couple of maps that we did with Counter Tools Mapper. And the light areas are the lower in household income, median household income. And you can see in Rock Hill, of course, it's a population center, but you can see, and also in York, how many retailers are positioned, in proximity to these lower income neighborhoods. And interestingly, on this one, although these are lesser populated areas, we have to pay attention to Western York County because if you look at the density, 6 or more retailers per 1,000 population, you can see how the western part of York County stacks up there, and of course Rock Hill to some degree as well. And then youth proximity. This has to do with retailers within 1,000 feet of parks and schools. The blue dots are schools and parks, and the red dots are either a park or a school within 1,000 feet. Now, 1,000 feet is roughly 3 city blocks. And studies show that within 1,000 feet that middle schools particularly that have retailers within 3 blocks have a higher prevalence of tobacco product use. So focusing in on that, the pink is the 1,000-foot diameter, and you can see the blue are schools or parks, and the red dots, again, we've got a lot of red dots in Rock Hill, up along, well, two key areas in Rock Hill. So we will be showing this to our school boards and elected city officials to support our call for tobacco retail licensing. Then the proximity with another retailer is also important, and going forward in a high growth county, what we think would be a smarter growth would be not having tobacco retailers clustered. So to kind of wrap up, next steps, there are one-on-one meetings with the city and county council members. Once we get our data in from the 2022 survey, and continue working with the champion. We've identified a champion at the Rock Hill and York County Council levels. Key Communicators is an initiative that Keystone York County, All on Board York County, and Tobacco for York County have developed over a couple of years. And in addition to our other efforts, we have people who, if we provide them with the talking points, who have pledged and actually signed just a simple paper form with their contact information, so we can put out a list of talking points, and they will be willing to talk with their elected representative. Continue growing our social media following over the summer. As I mentioned, we have been using some boosts, and we've been trying to hone in on current issues to build our following, and we've had good success. Aaron Paradiso, and I'll give credit also, a lot of credit to Alana Visbeck, who's also a Winthrop graduate, and they've been doing a fantastic job with our social media. And we'll be pointing towards our community education event in September. So that's what I wanted to cover. I hope I maybe gave you all some ideas. If we can get before preemption starts to confuse everybody's minds from the state level, our goal is to get a model TRL ordinance through in both Rock Hill and York County, and that's the by the end of certainly hopefully before the election, although we don't have any county people who are up for election. That those all occurred last year in the off year. Any comments or questions? I'll turn it back over to Tara and Barbara, and I think we'll have time for questions and discussion a little bit later in the hour.
Thank you, Dr. So we did have a question in the chat from Miss Dorothea Lewis from Blue Cross Blue Shield. And she wants to know, and you or Aaron, obviously can answer this question, but what type of social media messaging helped to keep others engaged with your tobacco-free efforts?
You want me to take this one, Dr. Keely?
Yeah, go ahead. Yeah.
So we do have an Instagram, Facebook, and a Twitter. And I think kind of the first part of that is knowing the different populations that are on those different platforms. So our Facebook is definitely more of our voting age, a little bit older parents of high school students, parents of middle school students. Our Instagram is a lot of small businesses. So we've started to kind of partner. There's a few restoration companies and stuff that interact with a lot of our posts, and we interact with a lot of theirs. So kind of just getting out into the small business agency organization part. And then our Twitter is a lot of high school athletes, which is really cool because that's kind of a population where we definitely want to catch them before they start, because they're looking at, football, college scholarships and that kind of stuff, and being active and athletes and keeping their physical health up. But we've been doing a lot of education posts. So things like the prevalence, or especially for this month, we've had 2 posts. One was for Pride, so talking about LGBTQIA+ populations and the prevalence of tobacco use with them. And the other one was minorities, especially Black populations, with Juneteenth. And we focused on menthol products with them. So kind of just doing targeted educational posts. And then on Facebook, we've done a lot of quitline stuff. On Twitter, we repost a lot of FDA, CDC, and DHEC. So just kind of sharing information, sharing prevalence rates and all that kind of stuff, research. And then as we kind of get more of a following, we are going to, and we get the post surveys done and assessed and analyzed, we're going to kind of branch out into our TRL stuff and maybe pushing a little bit more of the message itself instead of just the education and awareness.
And all that, thank you, Aaron, that was great. I have to give credit, back at the beginning of the year, Aaron and Alana came up with the What's Your Why campaign, and they invited people to send in, the answer to that question related to tobacco products. What's your why? And that really caught on. And then we also, Barbara will be happy to hear this, we're promoting the statewide tobacco quit line competition for people to quit and be enrolled in a potential to be rewarded. It's a statewide tobacco-free quit line challenge. So we're rolling that out and going to be promoting that.
Yes, I am one of their biggest fans. I get up every morning and the first thing I do is go on Instagram to see what Aaron's posted every morning. Love it.
Any other questions? Yeah.
I have a question. I think at the very beginning of your presentation, the list you shared of your local partners is very impressive. Not just the length of the list, but just the diversity of those partners and how, like you mentioned, the firefighters and the faith based churches, and just things like, partners who we may not think of, outside of those traditional partners. And you don't have to go into a lot of detail on this answer, but just what did some of those beginning conversations look like with some of those partners at the, back in 2007 or 2011 when you were establishing those relationships? How did those relationships start?
Well, real quickly, as far as the faith community, I was approached by a graduate student in public health that wanted a project, and it was her idea to engage churches. And so she actually, compiled a whole list of all the churches in York County, and we communicated with them and offered that they could get free tobacco-free campus signs through. We got the grant with the Elks. So that really got that started. And I think it's just that, it may be that, I've been in the community for so many years that people kind of, have a certain credibility. So if I approach them with, hey, what do you think about this? They, I get good response. Yeah.
So it almost goes to
maybe
you need a champion on your coalition team as well.
Yeah. Maybe the key is, finding a champion for your coalition, and letting that champion kind of talk things around. Service clubs and organizations are a good way to get the word out, and then, offer them to make contact. And before COVID, we would get invited to different events like that. So hopefully that'll get going again.
Thank you. Any other questions? Okay, well, thank you so much, Dr. Keely and Aaron, for presenting. I think we've had a lot of valuable information. Thought-provoking is a word that was popped up in the chat. So I do think that the work that you're doing is definitely going to help others start implementing positive work in their communities as well. Now we're going to transition to Beth Johnson, and she is going to give us a legislative update about what's happening in the state of South Carolina regarding tobacco prevention. Thanks for joining us, Beth. I know you've had a busy morning.
Yeah, thank you. I'm sorry I missed the presentation, Dr. Keely and Aaron, but I know that it was, great. And I'm looking at the chat box. It says great presentation and great work. This is, you guys in Rock Hill have the best coalition around the state. And I can say that so easily because you guys just do such good work, and we have really good coalitions around the state, but you guys are number one. You're leading the pack, and it's such a great example for everyone. So thank you. I triple booked myself at 10 o'clock today. I don't know how that happened, but anyway, I'm glad to join you and give a brief update. The General Assembly met last week for special session for one day, and they have one more day this coming week that they will be meeting to finalize the budget vetoes from the governor. But it's been an interesting session, and many, many thanks to everyone that helped stop preemption, the really bad tobacco preemption bill that we've been fighting now really for about 5 years. So thankfully we were able to stop preemption. It is dead for this year. And thank you guys so much to everyone who participated in that and who helped with that. The preemption bill would have prevented our local communities from working on local flavors or local tobacco retail license like the Rock Hill group is working on. So really, really exciting. And we do expect it to be back next year. We expect preemption to be back, but maybe we'll be, we'll be prepared. We pulled out a lot of big stops this year and certainly had a lot of great volunteers. I think at one point, Dr. Keely was texting with his senator and emailing with his senator back and forth and gave us some really good intel. In fact, we were just talking about that, Dr. Keely, on another call that I was on, how important it is that we're all reaching out to our senators and to our House members and letting them know about this legislation and asking them to stop it, to prevent tobacco preemption. Things that are happening right now in the General Assembly, lots of crazy changes going on. We have a new speaker in the House. We had a new Senate president this year. We are going to have a change in leadership with the House Majority Leader. And that's going to be really interesting for us because the House Majority Leader has been the one to introduce the tobacco preemption bill the past 2 sessions. So we'll see if anyone takes up his place. The new House Majority Leader will be Davey Hyatt, and the upstate, David Hyatt. So we are working with him now to get an appointment and see kind of what he feels about the issue, as I'm sure that tobacco industry and the Retailers Association will they haven't already, will soon approach him about introducing preemption. But historically in the House, we've seen the House Majority Leader and the House Minority Leader introduce the bill. Big kudos to our new Senate President, Senator Alexander, this year, who was able to work with us behind the scenes to stop preemption in the Senate, really at the very last second. And so if you're in the upstate and you're in Senator Alexander's district or area, he's in the Walhalla, Oconee area, then definitely send him a note of thanks to let him know we appreciate him kind of working behind the scenes and pulling out some things for us when he was not opposed to the bill, at least publicly. He helped us behind the scenes. So a lot of behind the scenes work that happened there kind of in the last week of session. As far as what's kind of looking ahead coming next, we'll do an organizational session in December. The General Assembly will have an organizational session in December, and we'll know a little bit more as far as our committee chairs and who we need to be targeting, who we need to be really paying attention to. And at that point, we'll reach out to you guys and let you know who those members are. And if you live in their district, then how you can help us. And again, just as a reminder, I know that there's always questions about what can I do, can I not do this because of lobbying? And so my first rule of thumb is always ask first. Always ask your direct manager, your direct report. Ask first, and then let me know how I can help you, because there are things that you can do if you are a state employee that you can help with lobbying and contacting your state legislators. That's perfectly fine and legal for you to do. But we would like to help you kind of walk through what you can and can't do within those parameters, so no one gets your hand slapped by the South Carolina Ethics Commission. We do not want that happening. But we do want and need your voice. So we can help you figure out what you can do and how you can share your voice and how you can share those stories that you're hearing from the community and from the coalition partners that you are working with. So I think that is about it for our state legislative session, kind of our wrap up. Lots of things in the works, and I'm happy to answer any questions.
Well, that's just a comment. Thank you again for all of your efforts, along with heart and lung. I think the thing that we can all do with November is be asking about tobacco. If you have a local tobacco concern in your area, ask the candidates when they have candidate forums, you know,
Yeah.
what they think should happen as far as youth and access to tobacco products, and you know, and then you know, you can make that information known to other voters, so that maybe we can get some people elected in November who will be, you know, have a kinder ear towards tobacco prevention and control.
Absolutely, Dr. Keely. Yeah.
Are there any other questions for either Dr. Keely or Beth? Okay, I'll pass it over to Barbara, who has a closing statement for us.
Okay, I just wanted to thank everybody for attending today. Especially thank you to Dr. Keely for this great presentation. As everybody has stated, York County is the leader in South Carolina in local tobacco initiatives. So we really appreciate you coming on and giving us an update on what y'all are doing and what you've done in the past. It was great to hear. And we hope everybody can attend next month. We're going to have Jaron King and Dan Kilpatrick from DHEC come and talk about the data they collected in the latest youth tobacco survey. So I know that'll be an informative presentation, and I can't wait to see what they've learned. So please register for that one in July. And I think that's it for today. Tara, anything else?
Nothing important. As you know, we are recording this meeting. We will post it to our website, to our YouTube page. So if you have any questions and you want to come back to the presentation, you can. If you want to pass it along to others in your organization, please feel free to do that.
Tara, I also mentioned to you that I'm willing to share the slides. If anybody wants the file, I can I guess let Tara know, and then we can.
Yeah, we can post that on our list.
Post that up.
We can post that, and then others can access it if they would like. That's a great offer from you. So thank you.
Yeah, thank you, Dr. Keely, for that.
All right. So if there are no other questions or comments, I hope you all enjoy the rest of your Friday afternoon and have a great weekend. Thank you for joining us.
Thanks, guys. Bye-bye.
Bye.
Bye, everyone.